I'm Dr. Jay Hobbs. Welcome to Synergy Chiropractic and Natural Health, our talk on scoliosis. So scoliosis can be really scary for those who have it and parents of kids who are dealing with it, or spouses when it happens with an adult. I've been treating people in Visalia for about 20 years and scoliosis that whole time, and we've had some really good success. And we continue to learn more things and be able to apply them. So I want to share with you today the information that you can use so you know what to do with scoliosis if you encounter it or you're concerned about it. So what is scoliosis? Scoliosis is a curve in the spine, a sideways curve. There can be many causes, but most commonly occurs in adolescent girls starting between 10 and 12 years of age. And scoliosis usually gets worse with growth or age. Adults can also have scoliosis. It may come from when they were younger, when their scoliosis developed, or they may develop it later in life as a result of degeneration. So if the bend in the spine gets above 50 degrees of curve, surgery is often recommended. And patients with scoliosis can develop back pain, asymmetry in their body, appearance, and postural deformity. So catching it early and applying the right treatment can stop the progression of the curves, and in some cases achieve correction of improper posture or reduction of the curve. So we'll talk a bit about bracing today, but even before we use bracing, there's a lot that can be done with exercises, specific home therapy, and treatment in the office. And I usually expect to get about 25% improvement, even in adults where the changes are supposedly permanent. Sometimes we get better results, sometimes less. So what does scoliosis awareness mean? That's what we're talking about. So it's being aware of what scoliosis is, who can be affected, recognizing the signs, knowing what treatment options are available, knowing when's the best time to treat, knowing where to find treatment if needed, and sharing this information with family and friends. So who can be affected? Well, the prevalence of scoliosis increases with age. So somewhere between 30 and 68%, depending on what population was checked, 30 to 68% of those over 60 are estimated to have scoliosis. That's a lot of people. Scoliosis can run in families. And the prevalence increases rapidly from 11 to 14 years of age as children grow quickly. This is when their spine is growing. And so this is an exciting time to make improvements because we can take a problem and really make a largely permanent fix during this time. But it can be really scary if nothing's done or not aware of something because it can get a lot worse during this time. An estimated 2 to 3% of children aged 10 to 15 years old will have scoliosis. Infants and juveniles can also have scoliosis. So why does one get scoliosis? Well, there's idiopathic and adult scoliosis. Idiopathic means of unknown origin. There's no definitive answer why infants, juveniles, and adolescents get idiopathic scoliosis. Research has shown that there might be a family link, so there could be something genetic involved. Adult scoliosis can be scoliosis present from when they were younger and only diagnosed in adulthood, or it can be degeneration of the spine later in life. They call that de novo or new scoliosis. So we do know that early and accurate detection leads to the most appropriate treatment. It can be the difference between a patient needing to undergo surgery or not. And even in adults, the earlier appropriate treatment is starting, the earlier it started, the better. The Scoliosis Research Society, the premier spine society, says there are documented benefits of earlier detection and non-surgical management of adolescent idiopathic scoliosis, abbreviated AIS. So it's important to recognize the signs. There's no consistent formal scoliosis screening that's in place in schools across the country. California removed the mandate years ago. We're hoping as of 2019 or maybe 2020, it looks like that may come back. The California school nurses are working hard to make that happen. So for now, it's important that we all recognize the signs. And summer is an especially opportune time to check kids for their back for any sign of scoliosis. So here's how we do a standing assessment. Have the person stand in front of you with their feet slightly apart, 6 inches or so. Let the arms dangle down to their side. So now I want you to check, tell me if you can see what's off here. So we're looking at the shoulder heights and the scapula, or the shoulder blade. Okay, shoulders uneven and prominent shoulder blade. So left side is a little low, and the right, number 2 there, the scapula is more flared or prominent. Okay, what about in this one? So if you see an obvious curve of the spine, then that's clear. And then also uneven hips. And our last one here, you can see this on the picture before, but it's identified here on number 5, and that's an asymmetry of the waist. You can see how it's indented in a little bit more on one side. That's a sign of an underlying scoliosis. So next, have the patient bend forward, or have the person bend forward with their feet together and knees straight. For the thoracic rib hump, check, let the arms dangle with palms together and fingers pointing down. For the lumbar hump, check, have the child bend farther down. So this is for the thoracic rib hump. And bend farther down. You can see on the left there the lumbar hump. And that's a sign of underlying scoliosis. Any of these signs may indicate a possible scoliosis and should be followed up with a qualified scoliosis clinician. Early detection is crucial, and new technologies can play a role in at-home screening. I'll tell you about that in a moment. So parents and friends can check loved ones in the comfort of their own home. So there's a cool little app. It's web-based, so you can use it on your phone or on your computer. It helps you identify important signs and risk factors. So it's at app.scoliescreen.com. And this is what it looks like. It goes through these different screens, and then you answer yes or no, and you answer a couple other questions, and then it gives you a score at the end, lets you know how probable scoliosis. So this would be, in one case, if you had a lot of those showing up, there'd be a higher risk. So what happens if scoliosis is not detected or treated early enough? Well, here's a normal spine. And this is someone who might be there before consultation, before they come in to be treated for scoliosis. You can see a curvature there, and this is not good. But at this point, we might not call it scoliosis, we just call it a curvature. Left untreated for a year, it can go to this point, and this is an actual case where it did. So what about treatment? In small postural curves where the scoliosis is less than 20 degrees, no aggressive treatment may be needed, but should be checked and monitored by scoliosis conditioning, because there's definitely things that can be done. When we say aggressive, you may not need bracing or certainly not surgery, but something should be done and should be monitored. If we can make it reduce, that would be great. And we certainly don't want to let it increase. So when the scoliosis is larger than 20 degrees, it's important to have a full assessment by a scoliosis clinician. Now, each case is different and requires expert assessment and the right treatment. Treatment types will depend on the person's age, stage, and type of scoliosis. Research has shown that the non-surgical treatment options of scoliosis-specific exercise and 3D custom scoliosis bracing have documented benefits. So what does the research say? Here, specialized scoliosis bracing, when prescribed for high-risk patients, has been shown to prevent the need for surgery in most cases. Bracing is an effective treatment method for adolescent idiopathic cases, scoliosis cases, characterized by positive long-term outcomes. And that's what we like. Conservative treatment with brace is highly effective in treating juvenile idiopathic scoliosis, with most patients being 80% achieving curve correction or curve improvement. And that's exciting. When specialized scoliosis physiotherapy has been used in conjunction with bracing, it's improved the results of hard bracing. So this is what we do in our office: is we combine. We try to avoid bracing if possible, doing home therapy, specific exercises, and in-office treatments, and then we can always combine that with bracing if needed, and that works best if necessary. Important to have bracing in adults significantly reduces progression of curvatures and improves quality of life. So often improving gait or walking, as well as balance and reducing pain. So regular screening plus detection equals better outcomes in treatment. So we catch it early and we do the right thing, it's going to turn out better. So let's look at this case. 13-year-old patient with 33-degree scoliosis. That's a big curvature. That's a big scoliosis. Initial postural assessment. Obviously we can see those signs of the curvature there, and the spinous processes are marked to make it a little easier to see. This is the patient with the scoliosis brace, which is used as an overcorrective approach, or we'd call it a mirror posture approach, pushing them in the opposite direction to their curve. And this is postural assessment after 12 months of treatment. So there, it's really difficult to detect the dysfunction. So looking so much better. And that's their spine out of the brace after 22 months of treatment. So this is excellent. So here, 27-degree improvement from 33 to 6 degrees. All right, let's check another one. 3-year-old. This is a small child, only with 40-degree curvature. This is dramatic. This is what they look like. X-ray showing 33 degree scoliosis in a traditional brace. So this is key to understand. Not all braces are the same. So this is great, right? Reduces at 7 degrees. That's really nice, but it's not all we're looking for. So the patient with a scoliosis brace, which uses an overcorrective or mirror posture approach to push their spine in the direction opposite their curve and include the counter rotation, because every time there's a side bend, there's also a compensatory rotation. So here, improvement out of the brace of 26 degrees after 24 months of treatment. So it went from 40 degrees to 14 degrees. Now, of course, we'd love that to be 0, and it can continue to progress and to improve. But this normally would have gotten worse. 3-year-olds with a 40-degree curve expect that to get worse, and then they would probably have to have subsequent surgeries. So this is excellent. So parents and grandparents or caregivers should check children for scoliosis. Obviously, medical practices, chiropractors, physical therapists, etc. are great resources for scoliosis screening, so any of them should be able to check for this, at least on the basic level. And then an organization that makes these Scoliosis braces called Scoliosis has certified health professionals around the world with extra training and assessment and treatment. And our office at Synergy, of course, we've gone through that. So, scoliosis. If it's picked up early, scoliosis can be very effectively treated with the new generation of scoliosis brace. Even for adults, detection and treatment can improve pain and quality of life. And summer, when kids are in the pools, etc., is a great time to start checking children and grandchildren for scoliosis. If you find something, get them assessed by somebody who's qualified. And to avoid surgery, the most important thing is that the patient receives the right treatment at the right time. All right. Thank you very much. Have a wonderful day. If you have more questions, please give us a call or talk to us in person.